Welcome everyone to this conference session on fresh approaches, enablers and solutions to balancing work and care. We have three presenters in this session, followed by a discussant and Q&A. So we're going to move straight into the first session, which is by Winnie Lam, who's a PhD student at Sheffield University Management School at the University of Sheffield. So Winnie, the floor is yours.
Thanks, Jason. So again, my name is Winnie. I'm a PhD student in Sheffield University Management School. I'm supervised by Professor Karina Nielsen and Dr. Ciara Kelly. So my research focuses on the experience of working informal carers of older people. Next slide, please. So I just start off my presentation with a meme. So just imagine I have to work and have to care for an older person in my family. So probably what my boss thinks that is that I'm working very hard. My family expects that I'm providing attentive care to the older relative. However, I have not attended any friends gathering for a while. So what I actually do is I juggle multiple demands and I am experiencing burnout, stress, and anxiety, and so on. However, the society does not really know what I'm doing. Next slide, please. So the aim of the study is to understand the daily experience of working informal carers of older people and identify the challenges they face and what help with them in managing the responsibility from both sides. And I'm using the demands and resource model to present. Next slide, please. Three research questions are, what are the care tasks for working informal carers of older people? How do they interpret their experience? And what are the demands and resources for them? So next slide, please. So the data was collected from the UK and Hong Kong. A total of 18 working informal carers of older people joined. I used thematic analysis to analyze the data. Data collected were mostly aligned with the requirement, which is to write or record diary for 14 days consecutively regarding their work and care experience. Next slide, please. So regarding what care activities they perform, they assist with activities of daily living, such as assisting with toilet visits, showering. They also assist with instrumental activities of daily living, such as shopping and cooking. There are some activities that have not been mentioned quite frequently in previous research, such as performing life administration activities, which include supervision, surveillance, managing paid care, coordinated with others who are also involved in care, application for welfare payments. So it's pretty much doing work that you normally do at work, but at home. Next, informal carers also provide social and emotional support, such as providing a company, checking up, having a chat, or listen. Furthermore, as the care recipient are usually someone close with the carer, so the carer also think about the quality of life of the care recipient, hoping to enrich the life of them. They'll think of something good for them to do, such as planning suitable leisure activities and plan for holidays. For example, a participant who is caring for her mother with dementia mentioned that she planned a lot of holidays with her mom because she wants her to be able to visit more places when she can still walk. Next slide, please. So in terms of how carers feel about or interpret their experience. So when in terms of providing informal care, so maybe a full screen would be good because the text is a bit small on this slide. Please, thank you. Yes, so in terms of providing informal care, some participants interpret this as mutual support and perceive it quite positively. Participants can also perceive it negatively, feeling that this is emotionally, but they are emotionally burdened, and such feeling may not be triggered by any big events, but day-to-day hassles. Some participants perceive it quite neutrally, stating that this is the responsibility as children and should not be viewed as a burden. Or maybe this is just a stage in life, just like we have to go to school when we were young. Next slide, please. So in terms of day-to-day care experience, so I'll give an example. During potential stressful moments, a participant reported that she was angry when there were conflicts between she and her grandmother, because her grandmother were making a lot of requests when she wanted to concentrate on the news. A participant actually mentioned that she felt relaxed and happy when her mother was shouting at her on the phone, because this is an indicator that her mother is healthy. A participant also had conflicts with her aunt because her aunt couldn't remember due to dementia, but then very quickly she accepts that this is the situation. In other occasions, participants reported different emotions for different events. I just highlight the above to show how people could interpret potential stressful events such as conflict happening during care quite differently. So there are many ways on people to interpret or appraise the situation, and that would impact their feelings. Next slide, please. So in terms of demands, participants reported that long hours and busy work made it difficult for them to provide what they perceive as good quality and good amount of care. They might also feel bad stress if manager or employer are not compassionate or not understanding towards their situation. Coordinating care can be a challenge, especially when things do not go according to plan. And inadequate financial resources can also impose challenges in providing care. For example, a participant mentioned that she can't afford to buy a car and pay for extra treatment for her mother. Another participant reported that she needs to spend more time and effort to manage her finance. And in terms of resources, having supportive colleagues or supervisors allow you to be flexible with work time, workplace, and even just not having to work overtime can help. Flexible work arrangement offered by employer can be helpful for carers to manage care, for example, to attend pet, family, friend support. No matter it is instrumental, so someone is actually doing some things for you, or it is emotional, they're both helpful, and care recipient having their own social time and network can also alleviate the worries of carers because they know that someone is with the care recipient. Having the financial means, of course, could help, for example, in terms of having paid help, and in Hong Kong, employing migrant care workers to do round-the-clock care is encouraged in the policy. Next slide, please. So just a quick summary of the findings referencing the cognitive appraisal framework. How we understand about, now we understand more about the event, which is informal care. We also understand that people can interpret events differently. They can interpret both elder care provision and the events happen during care quite differently. We now also know more about the demands working informal carers are facing and what kind of resources they can mobilize to cope with the dual responsibility. So looking at this under the cognitive appraisal framework, the highlighted part in the slides are the areas that this research has focused on. So next slide, please. So regarding theoretical implications, this method captures the day-to-day experience of informal carers and provided rich qualitative data which reviews that carers also carry out activities in addition to personal care activities and other household activities that are commonly described in previous research. It is now time to recognize informal care is more than just the physical side of care work, and we need to recognize the mental and cognitive side of care work, especially for informal carers, because of the relationship with the care recipient. They might work on a lot for their loved ones to live a better life and concern about their emotional well-being and their life enrichment. So next slide, please. What plays a part in how they perceive their situation can affect their feeling and the way they cope. So I'm not saying that this is a very representative sample because it's a relatively small sample size, but this observation may give direction on future research. So a few factors that might affect how people perceive the situation, such as knowledge and education, so knowing what different health condition means. Past experience and personality possibly plays the part, especially during the earlier example that I've given, that a participant felt happy that her mother was shouting at her, and also other co-occurring situation, such as if the carer have other things to handle at the same time. So there could be implication for possible training and intervention. Next slide, please. Just to sum up my presentation with some practical implications, we now know that every part of the society plays a part in supporting working informal carers. Demands and resources come from all different aspects of life, and every part of the society plays a part. Support from social networks, employers, and governments are needed to help carers to manage the dual responsibility. So next slide, please. So that's the end of my presentation. Thank you.
Winnie, thank you very much indeed for a very interesting presentation. So we'll move to our second speaker, who is Alice Lam, who's a PhD student attached to the Sustainable Care Programme based at the University of Sheffield. Alice, the floor is yours.
Hello and welcome to our presentation on the potential of technology to support working carers of a person living with dementia. My name is Alice Spann, and there is a small picture of me so that you know what I look like. This presentation is based on my PhD work at the University of Sheffield and is associated with the Sustainable Care Programme. Without further ado, let's jump right in. First, let me give you some context. Even before the COVID pandemic, 1 in 7 adults in the UK in paid work was a working carer. That means they combine work with looking after a family member, friend, or neighbor who is ill, frail, or living with a disability. To put that into perspective, that is 7% of the UK population. 1 in 5 of these working carers is looking after someone with dementia. Since COVID, these numbers have increased substantially, but we can expect them to rise even further in the years to come as people are getting older, more people are living with dementia, fewer publicly funded care services are available, and people are needed in the workforce for longer. Combining work and care can have massive effects on carers' employment, financial security, well-being, and relationships. Combining work and care for people with dementia can be especially physically and emotionally challenging, as people with dementia require high levels of supervision, which can lead to high levels of work disruption and stress. Under the right circumstances, technology can be transformative for working carers and people with dementia. But, according to Carers UK, 62% of carers are unaware of technology to support caring, and 26% of carers who are aware of technology don't know where to get it from. Working carers and those who support them want a signposting tool that collects information about all these technologies and helps carers identify technological solutions for their individual work-care reconciliation challenges. Our research thus aims to identify and map technologies with the potential to help working carers of people with dementia and develop the basis of a self-help tool. Carers and those supporting them can use this tool to look for suitable technological solutions for their individual challenges. To develop this self-help tool, we use a participatory design approach. Participatory design aims to actively involve all stakeholders, regardless of their expertise and abilities, in the design process of the product or service to ensure that the results meet their needs. Broadly speaking, a participatory design project has 2 phases. The first is focused on understanding the problem by empathizing with the people one is designing with and letting them define the problem. The second phase is focused on exploring the solution by ideating, prototyping, and testing the solution. To understand the problem, we conducted semi-structured interviews with 16 working carers of people living with dementia. Our interviews focused on carers' challenges when combining work and care, the impact their autonomy at work had on their ability to use technology and respond to care-related emergencies, and their experiences and preferences regarding technology. Based on these interviews, we identified 7 work-care reconciliation challenges, which are as follows, in no significant order. Having to manage the care network while at work. Carers found this stressful, frustrating, time-consuming, and disruptive to their work. Attending appointments with healthcare professionals involved in a person with dementia's care. These appointments were in direct conflict with carers' work hours, which meant that they had to take time off or risk missing the appointment and having to struggle to connect with healthcare professionals and collect all the relevant information afterwards. Providing entertainment, stimulation, and companionship for the person with dementia. This was particularly worrying for carers who worked and cared from home. They often felt guilty for having to prioritize work over keeping their loved one company. Dealing with their own psychosocial and emotional stress, of which there was plenty. Worrying about the person with dementia's safety and well-being when they couldn't be physically present themselves. Carers particularly worried about accidents such as falls or leaving the stove on, as well as people with dementia getting lost while out and about. Finding and accessing relevant information about caring and available support, both for themselves and the person they cared for. And providing personal care. For the most part, this could be planned and managed around work, but for working carers who worked and cared from home, assisting with mobility and bathroom-related issues regularly led to work disruptions. We then started to explore potential solutions to the challenges carers identified. To ideate, we first conducted a comprehensive review of online sources and grey literature. We looked at online care technology databases, including Living Made Easy, AT Dementia, ALS Products, and Live Better with Dementia, from which we identified more than 12,000 individual products. Google Play and Apple App Store were screened and led to the identification of 432 relevant apps. And we also looked at conference proceedings to try to find out which technologies are currently in development. We looked at the Gerontological Society of America, the Alzheimer's Association's International Conference, and abstracts listed in the IE Explore databases between the years of 2015 and 2019. This resulted in more than 28,000 abstracts to be screened. We also conducted targeted Google searches and snowballing to look for further potential solutions. We then screened all these results according to their usefulness for addressing the challenges that our carers identified in the interviews and conducted a webinar with 18 technologists from industry and academia to get feedback on the comprehensiveness of the identified technologies. We did this to find out whether we might have missed any relevant technological solutions and added any of the results to our final selection. In total, we identified 136 technologies which were catalogued according to the work-care reconciliation challenge they aimed to address. To be clear, these 136 technologies were no longer individual products, but rather certain kinds of technology. For example, we consider both an Amazon Alexa and a Google Home to be a smart speaker and list them as one technology. However, there are many multiple entries in our catalog, as many technologies are multifunctional and address more than one challenge. Smart speakers, for example, were listed as solutions to the challenge of keeping the person with dementia entertained, as well as to the challenge of worrying about the person with dementia's safety and well-being, as they enabled carers to call the device and check in with the person with dementia. And finally, to prototype and test our catalogue of potential solutions, we conducted co-design research. Traditionally, this is achieved in real-world workshops over the course of a few days. Due to COVID, however, we were forced to be creative. We came up with a novel approach to conducting this kind of research online, using a custom-made website. For this website, we had two incentives. First, to get feedback on our identified technologies, and we did this by asking participants to comment on a series of technology blog posts. And second, to get participants' views on a number of design aspects of the suggested self-help tool. For example, whether they preferred a paper or an online version, whether they wanted to see comments of working carers who had already used these technologies, and whether they wanted to have a discussion forum on this online version of the tool. Although recruitment and keeping participants engaged with the research was very challenging, we were able to gather very insightful data from various stakeholders' perspectives on what needs to be considered when using these technologies. All the information we collected is used to inform the basis of our self-help tool, which is structured as follows. First, we consider what challenge solutions are sought for, i.e., what is needed. As an example, our working carer is concerned about the person with dementia having a fall. When looking at the technologies, we then consider the purpose of the technology, i.e., how is it meant to help? In our example, we want to enable the person with dementia to call for help. We then have to consider the function of the technology, i.e., how does it work? We have, for example, a wearable panic button that sends out a distress call when the person with dementia presses it. And lastly, we have to take into account that these technologies have to be used under very complex and dynamic circumstances involving multiple stakeholders. We have to ask ourselves whether and how these stakeholders are able to use the technologies and how they are personally impacted by their use. For example, can our working carer receive the distress call, and are they able to respond? Is the person with dementia even able to press the panic button? How does using the technology impact the workplace? Will there be any disruption? What impact has the technology on care workers? What technological requirements or restrictions need to be considered? For example, what is the range of the alarm? Can it be worn outside the house? And so on. To reiterate, under the right circumstances, technology can be transformative. This framework intends to assist working carers in the difficult task of looking for suitable technologies in a market that is both oversaturated with specific solutions, for example, community alarm systems, while at the same time being woefully underdeveloped in other areas, for example, regarding care management or providing personal care. And this is already it for our presentation today. Thank you very much for your interest. And if you have any further questions, please do get in touch with me via the email address provided on this slide. Thank you and have a great day.
Alice, that was great. Thank you very much for your presentation. So we move to our third and final speaker, who's Cathy Thomson, who's a research fellow at the Social Policy Research Centre at University of New South Wales. Cathy, over to you.
Thanks. Before I start my talk, I would like to acknowledge the Gadigal people of the Eora Nation, the traditional custodians of this land, and pay my respects to the elders, both past and present. Next slide. I'm presenting the paper today, but I'd like to also acknowledge my co-authors, Myra Hamilton from the University of Sydney and Sarah Judd Lamb, who works at Carers New South Wales. Next slide, please. So first, in the talk, I'll give a brief overview of the current policy context in Australia in which care is provided, including the care sector, aged care and disability. Then I'll talk about the barriers carers face entering the labour market or sustaining paid work, and discuss some of the current policies and services that are somewhat aimed at addressing these barriers in Australia. Then, using data from the National Carer Survey, I'll look at the implementation of one national program to examine how carers' employment is supported or not. And then finally, I'll discuss the concept of replacement care and argue that it needs to be thought about differently if it is to support carers to be job ready and also to maintain their paid work, and then present a holistic approach to supporting carers' employment. Next slide, please. So now there's fairly widespread recognition that carers face multiple barriers to participating in paid work. Few studies, though, have attempted to understand how these barriers intersect and the impact of the wider service and policy context on carers' employment. So consequently, policies aiming to address carers' employment in Australia tend to be implemented in isolation. One example of this is the way the Australian government approach to replacement care is limited and lacks an understanding of the interaction between carers' needs and preferences and the service and labour market landscape. So with this in mind, the paper aims to develop a holistic approach to improving carers' employability. Next slide, please. Thanks. Over the last 3 decades, there has been greater recognition of the barriers carers face in trying to get a job or maintain their job without reducing hours that they want or need to work. And you can see on the left-hand side of the slide, these barriers include things like not having enough time and money to look after their own health and well-being, restrictive eligibility criteria for income support, a lack of job seeking or opportunities for training or retaining or maintaining their employment. Other things are lack of flexible working hours or access to leave. Then on the right-hand side of the slide provides some examples of initiatives that have been implemented to support carers, such as in Australia, carers can receive a carer payment, but they're limited to 25 hours of work or voluntary work or training, and that includes travel time. In-person respite services delivered under the Carer Gateway now include emergency respite as well as the capacity for limited plan respite to be funded under the Carer Direct packages. It's only up to $3,000 within a 12-month period. And although these supports are important, they don't provide a holistic or integrated approach to supporting carers into work. Next slide, please. So in Australia, the service landscape is undergoing significant reforms in terms of support for younger people with disabilities, in aged care and support for carers. For example, in the care support sector, the most recent reforms involve the launch of the range of nationally available in-person, online and phone-based supports through what is called the Carer Gateway. The Carer Gateway has continued to fund replacement care services called respite, as well as other support types that tend to complement rather than replace respite and respite-like supports delivered under other service systems such as the age and disability services. And it is expected that carers will be able to access planned, regular, ongoing breaks from caring through these other service systems. Next slide, please. In the disability and aged care sectors, these reforms have been implemented as a way of addressing the fragmentation of services. They've moved away from block funding to direct funding of individual consumers, and the funding follows these consumers. So rather than focusing on outputs, the reforms are focused on reporting outcomes. However, in the carer support sector, there's less emphasis on consumer-directed funding and very little emphasis on employment outcomes. Next slide, please. So it's evident that the current service landscape, it's difficult for carers to navigate. It contains siloed service systems that don't recognise the interrelatedness of carers' needs. Currently, supports for carers emphasise sustaining their caring role and not carers' employment. It's based on an assumption that support for people with disability or older people have a respite effect for carers by reducing the demands on their caring role and then providing them with more time, thereby improving the employment options for carers. However, is this the case? Next slide, please. To answer this question, I want to look in a bit more detail at the National Disability Insurance Scheme, or the NDIS, which is a national scheme in Australia that provides funding and support for services directly to eligible individuals aged between 7 and 65 years, with people with intellectual, physical, sensory, cognitive and psychosocial disability. It's assumed that by providing better services to people with disabilities, carers will be freed up to participate more in paid work. The NDIS supports may indirectly benefit carers, but carers cannot access support in their own right unless they have a disability themselves. The NDIS policy and procedure explicitly relies on and encourages ongoing informal care arrangements. Carers' needs, including their employment needs, aren't necessarily included in NDIS planning. So there is no direct support for carers to work within this scheme. Next slide, please. By looking at some of the findings from the National Carers Survey, we can see that carers' employment is not supported by the NDIS. So this survey was conducted by the Carers New South Wales, and it was a statewide survey of family and friend carers in New South Wales. And in 2020, it was the first time that it had been conducted nationally. So all the other state and territory care associations were involved in the survey. It was distributed online and in hard copy, and there were over 7,000 responses. Next slide, please. So in this slide, you can see that the majority of carers don't think that the NDIS is helping them to work, although you can see that a higher proportion feel that it has given them a break from their caring role. Next slide, please. And the next slide provides some insights into why this might be the case, as it is difficult for carers to access information. They spend a lot of time trying to organise services, and there are also long waiting periods for services. Next slide, please. So we argue that we need to rethink of replacement care, where the starting point is not having a break from care, but rather what kind of time does the individual carer need to participate in other activities, including paid employment. This approach helps us to situate the system of services we currently have into a broader framework of what we need to build in order to improve carers' opportunities to increase their participation in work. You can see in the figure on the slide that most of our policies and services are focused on the left, time to improve health and well-being, and a very small amount in the middle to support participation in education and training, such as limited support for young carers, but nothing on the right, time to be available for work. We think this is a useful framework for underpinning policy and service interventions to support participation of carers in employment and other activities. For example, if we're going to provide a peer support program for carers, or work with universities to provide flexible options for carers, or to better support carers for job seeking, what kind of time will carers need to be able to participate? That is, how many hours, how often, what times of the day, and so on, because that is the kind of replacement care that needs to accompany that sort of intervention. This type of framework that focuses on the qualitative nature of time required by carers to participate in different kinds of activities can help us move away from the notion of indirect respite, or that respite effect, the assumption that any time off is enough for carers, which is dominating many policy discussions on consumer-directed care, style disability and aged care services. Next slide, please. The replacement care is foundational, but is not in itself adequate. We have to have adequate replacement care for carers to do all the things they still need to do to continue the important work towards creating carer-friendly workplaces. The dominant way of thinking about replacement care, that is providing a bit of respite, mostly in emergency or even indirect respite, will support carers to prepare, will not support carers to prepare or participate in work. We must think about it differently if we are to meet the demands and needs of carers. Next slide, please. So the way we're thinking about replacement care is all wrong, in summary. We think that providing a bit of respite, as I said, or indirect respite isn't enough to help carers participate or remain in work. So a replacement care that is fit for purpose would move beyond the limited view of respite as a replacement care, be tailored to the needs of different kinds of time requirements, recognise that carers have different needs when preparing for or participating in employment, and also take account of the current labour market and employment conditions. Next slide, please. That's the end of my presentation. Thank you for listening.
Okay, Cathy, thanks very much indeed for such an interesting and detailed presentation. So at this stage, we'll move to the discussant section of the session, and I'd like to introduce our discussant, who is Katja Knauthe, who's a PhD student in the Sociology Department at University of Dortmund and University of Applied Sciences, Zittau-Görlitz. Katja, over to you.
It's about a deeper understanding of the emotional situation of informal care. The emotional mindset toward the caregiving situation influences the well-being of carers. In the conclusion, the practical implications show that caring of relatives should never be a single task, but a recognized activity to supported by official bodies, especially the employers and the government. These areas can and should provide support so that the care situation does not end in wear and tear on carer. Now we come to Alice's speech. She showed that 1 in 7 employed people in the UK are working carers, and 1 in 5 people cares for a person with dementia. The special aspect here is the intensity of care and the partial need for round-the-clock care. The challenges that were found are similar to those that Winnie presented us. They include organizing care, coping with emotional stress, and worrying about the safety of the person being cared for. Technical aids can help to make the care situation more manageable. However, a good 60% of working carers do not use technologies because they are not aware of them. And almost 30% who know about technologies do not know where they can get them. The aim of the research is to develop a self-help tool in which working carers can find technological support for their individual challenges in the care situation. During the research, more than 12,000 technologies were found, as well over 400 relevant apps with technology support. Among them, 136 technologies were discovered that provide direct support for dementia care. Many of these fulfilled more than one need. For example, the smart speaker, it's for entertainment and also for safety. The technologies found were matched to the need of carers looking after persons with dementia and elaborated with technologists who had an academic or industrial background. To develop the self-help tool, a participative research design was used in which relevant stakeholders were involved. Co-design workshops were organized to jointly develop ideas for a prototype and test it. With the information collected, the self-help tool could be structured. The purpose, e.g. detection of falls, and the function, e.g. emergency call system of the technology were important, as well the impact on working carers, the person with dementia being cared for, and the entire support network, here the workplace and the care workers. With the right match to the needs of working carers and the family members in need of care, technology can simplify the care situation. When developing technology, care should be taken to ensure that it's closely linked to the needs of working carers. There is no need for technologies that are already widely available, e.g. smart home systems. But there is a need of technologies that are still missing, e.g. regarding care management or provide personal care. Last but not least, we come to Cathy's speech. Cathy said that the barriers for working carers to participate in the labor market have not been sufficiently researched. She frames the thesis that government policies do not directly support carers. Measures are implemented in isolation without any consultation with the needs of the carers. The replacement care is used for an example of this, because the existence of adequate replacement care is an important precondition for the employment of carers. For the empirical part of the study, 3 Australian surveys were analysed with regard to their impact on carers. The evaluation of NDIS shows that it's possible for family caregivers through the service offerings to take a break from their daily responsibilities while taking care of their physical and mental health. However, it only enables to be or remain gainfully employed to a limited extent alongside care. The figures hardly changed over the period under consideration. In terms of maintaining employment, CHSP and HCP do not perform much better. However, professional services, in this case aged care, are more available and less bureaucratic to organize. This provides health and mental relief. Nevertheless, there are a long waiting time for services and information is difficult to find. This creates a gap in service, which is especially difficult in care emergencies. In the conclusion, it would be necessary to expand replacement care in such a way that carers have more time autonomy for organizing and providing care. The holistic approach here is to better tailor the offerings to the needs of carers and at the same time to take labor conditions into account. The extent to which professional activity can be maintained will also depend on the extent to which employers create flexible time offers for working carers. All three presentations illustrate the burden on working carers in an international context. If we look at the evidence base over the last few decades, we can see that the needs of working carers have not changed significantly, and much still remains to be done to help improve their situation. They need quick and unbureaucratic help, financial security, as well as a break from caring, which can be offered via replacement care or technical aids. Looking at the evidence of our three presentations, it appears that needs have largely not been met yet. Following this brief summary, I would now like to put some questions to our presenters. I look forward to your feedback and a lively discussion. Thank you.
Katja, thank you very much for your observations. So now without further ado, we'll progress to the question and answer session. So if everyone would like to rejoin the session, we'll begin. So our first question is, what measures do you consider most effective in helping working carers to reconcile care and work, and why? Winnie, could we start with you, please?
Yes, sure. So I think there is probably no one most single effective measure, but there needs to be a combination of measures that allows carers to manage their work and care responsibilities. For example, there needs to be flexible work from the government point of view. Maybe there needs to be policy that could allow the recruitment of paid care or daycare centers. So and I think the situation that different carers face can be very different due to the health condition of the care recipient and the care trajectory. So there really needs to be a holistic support for carers. Thank you.
Thank you, Winnie. And Kathy, how would you respond to that, please?
Well, I obviously agree with what Winnie has said. I think that's very true that carers have individual needs, so that the supports there needs to be a combination of supports that give people options as to what suits their needs best. I agree that you need support through workplaces. You need workplaces that are supportive to carers who are in employment. So you need access to flexible workplaces. You need access to leave. You also need a supportive work culture. And I think there's been research, particularly in the UK, that's talked about where you have managers who are supportive of it, that helps create an environment where it's supportive for carers to both balance caring and work responsibilities. But as I was saying in the presentation, I think what is lacking is support in terms of services that enable carers to participate in work. Those the services that are available now in Australia, there are some piecemeal programs where carers might be able to put together a number of different services, and it might enable them to work, but it's definitely not it's not common. So I think a policy that recognises that carers need access to services that are going to enable them to work. It's not just enough to have a couple of hours of respite a week. That doesn't help them. It gives them a break and it helps them maintain their health and well-being, but it doesn't really enable them to work. So I think that's a really important policy initiative, although it's expensive. But maybe less expensive when you take into account carers having to leave work rather than participate in work. Thanks
very much, Kathy. I think that leads us very nicely to our second question, which is, If you were a newly elected decision maker, what would be the first policy you would enact to make life easier for working carers, and why? So perhaps again, if we start with Winnie and then go to Cathy. Winnie.
Thanks for the question. So I think it's a complicated question. I think there are just so many things that I want to do if I'm a policymaker. But I think maybe the first thing I want to do is to make sure the society recognize the work of informal carers, especially for people who are managing work and care simultaneously. And also recognize the difficulty that carer face in terms of their health and well-being, and also they might need to leave their employment for doing so, and to promote an atmosphere that is supportive for carers. So after all, people need to recognize the need of carers, recognize the work that carers does to set a foundation for other policy. Yeah, I think that's all.
Thank you, Winnie. Cathy, please.
I don't want to be boring, but I agree with Winnie again. I think it's a difficult question and complicated, but I agree that recognition of what carers face, but also the value of carers, both the economic and social contribution of carers, is really important. And if we recognise the value of the care provided, then perhaps the way society operates can change a little bit. And I think that there needs to be legislative frameworks around recognition of care and access to services and support. I think you need income support, you need adequate income support for people who cannot work, because carers should also have the right to not work if they can't manage both those responsibilities. So they need to have adequate income support if that's the case. The employment conditions need to be supportive to carers, both in terms of access to leave and also flexible work practices, as well as the culture, and access to high quality and affordable supports.
Great. Thanks, Cathy. So the next question is, in your opinion, who should take the most responsibility for meeting the needs of working carers, and why? The carers themselves, employers, lobbying associations, or government? I think we're thinking here about the respective responsibilities of carers and employers, lobbying associations, and governments. What more could they do?
Oh, yes. So I think in terms of each body and each different parts of the society, I think they can all play a part in terms of how to support carers better. It's probably maybe the government could do the most in terms of legislation and policy, setting out setting out carers leave, setting out paid care or offering public care. But then I think each of them could play a part, and probably if all of them all do something together, then carers can be supported the best. I'm not sure if I'm responding to the question. Hopefully I am.
That's fine, Winnie. Thank you. Cathy, please.
Yeah, I mean, I think it's a shared responsibility. I don't think one body should be responsible for providing informal care. I think everybody plays a part, and even people who don't have care responsibilities can play a part as well, because they can support carers within the workplace or support the carers within the family. So I think it's true to say that both governments, advocacy organisations all play a part in supporting carers. Winnie, can I ask you a question? I thought it was really interesting when you talked about perceptions of different circumstances, and that example you gave where the mother was fighting, the mother and daughter were fighting, and but the daughter thought that was really good because it showed that her mother was still engaged and healthy. Can you talk a little bit more about that? And did you have other examples where that was the case?
So a little bit more background to the case. So the mother was actually quite old, I think in her 90s. So the participant did not provide a lot of background, but then from the diary I can tell that the mother has to go to medical appointments, and there is something probably, is it blood washing? I can't remember what is it called. But basically, she has a few health conditions. So, which I guess this sort of background or the past experience makes the participant actually feel quite happy that her mother is shouting at her, because this is an indicator that she is well, and possibly she is quite optimistic, I guess, and maybe after going through a lot of things, maybe, you know, her mother was like 90, and then she probably have prepared for something worse to happen, I'm guessing. So so that's why I said past experience, personality could affect how people perceive events and the emotion that they have as well. So I think it's quite interesting on how people maybe regulate their emotion, how to cope with stresses, and the way they perceive events.
Yeah. Interesting.
Any further questions?
So I have a question for Cathy. So if you don't mind, because I'm not very familiar with the policy and the current situation in terms of support to carers. So is it the case that in Australia currently there are support, but the support are quite inadequate? That's why a lot of carers need to leave their work for care?
Well, I think there are supports for carer. We just have this new thing which was implemented in 2019, and more of it's been implemented in 2020, called the Carer Gateway, and that has provided good access to things like counselling, peer support, and respite. But respite in terms of giving the carer a break and enabling the carer to look after their health and well-being. I think that what I was saying, that the support for carers in employment isn't enough, but what happens is that carers struggle on. Not all carers leave work. We have some quite good flexible arrangements and access to leave. People can access carers leave if they're in the public domain. But what I think isn't the case is that services aren't designed, like childcare is designed to enable parents to work. The services for older people and people with disabilities aren't designed to enable the carer to work if they want to work. So the short answer is that there are services available, and some of them are quite good, but the aim of the services isn't to support carers in employment. It's a flow-on effect, so that if you can piece together enough services from different providers, you might be able to cover yourself as you're working. What carers do, though, is often reduce their hours of work, and they have to interrupt their work, or they don't participate in training so that they can manage both their care and work responsibilities.
Thank you for the additional information. I very much agree that for some reason, in many countries, elder care services just aren't there for people, to enable people to work on like childcare.
Yeah. Yes, that's right.
So that brings our session to an end. I'd like to thank our speakers, Winnie, Alice and Cathy, and also Katja, our discussant. It's been a very interesting session, and thank you for your attention.